special interest is in epilepsy and goes beyond medical management, and that includes pre-surgical evaluation. So I want to welcome everyone, and hopefully we could address all of your questions.
All right. Thank you, sir. And now, Lauren, why don't you introduce yourself to the folks at home who haven't had the pleasure to meet you in clinic?
Yeah, so my name is Lauren Bradley. I'm a pediatric nurse practitioner. I joined Valley Children's in 2016, actually just shortly after Dr. Santos. I also see general neurology patients, but after working closely with Dr. Santos, I've taken over our epilepsy surgery program, case conferences. So basically what I do is I help coordinate all the studies, bring everything together and present to our neurosciences team. So radiology, neurosurgery, neuropsychology, all of our neurologists and our epileptologist, Dr. Santos.
All right, so we're talking today specifically about seizures and epilepsy. So many questions, so many misunderstandings and misconceptions when it comes to this condition. So let's start off, again, for those of you who are tuning in right now on Facebook, please feel free to leave your messages, your questions in the comment section, and we'll get those to Dr. Santos as well as to Lauren to answer them. But we started soliciting questions last week from folks through Instagram, Twitter, and Facebook. And the number one question that we saw, and it's a very basic one, is, I'll give this one to you, Dr. Santos. What is epilepsy?
All right. I'm glad that we're starting with that question, really, because there is a big misconception about epilepsy. And what do I mean by that? Most people, when they hear the term, one, it scares them. Two, and I think it scares them for a good reason, because their understanding of epilepsy is really not correct. Most people think of people with epilepsy as going to be mentally retarded. They're going to have seizures for life. They're going to be on medications for life. They're not going to go to school. They're not going to go to college, and they're not going to be able to live independently and have family and drive and so on and so forth. So yes, that's true for some people with epilepsy, but the term epilepsy simply means if you have had more than one unprovoked seizure, you have epilepsy, period. No more, nothing more. So the definition of epilepsy, more than one unprovoked seizure, you have epilepsy. Now, having said that, people would say, well, okay, but my child has had several febrile seizures. Is he an epileptic? No, because the key term is unprovoked. People with febrile seizures, that's provoked, the fever provoking the seizures. If you had seizures right after you hit your head and had blood or stroke, infection, those are provoked seizures. So no, simply two unprovoked seizures or more, you have epilepsy.
So, okay, let's go one step back. What's a seizure?
Yeah. Okay, the seizure, on the other hand, is the manifestation of epilepsy, right? So not everyone who has seizure has epilepsy. Mm-hmm. Everyone with epilepsy has seizures, okay? And seizures come in different forms. The most common that people know is the jerking type. They call it the big ones, or the grand mal, where they fall to the ground, they foam at the mouth, their eyes roll up, their body is tense, and they're jerking all over. That's the most common type, or that's a common type, probably the most common that people associate with epilepsy and seizures, but there are so many different kinds.
So, Lauren, talking about what Dr. Santos was saying earlier, and how there are so many misconceptions. You are, in many situations, one of the first points of contact for families who come to Valley Children's and when they come for their neurology appointments. What are some of the things that you've been seeing, and some of the biggest questions your families have when their children are having seizures? You know, we were talking about this last week. In the olden days, which frankly aren't that long ago, people thought it was a sign of possession. I mean, that's how ancient and archaic some of these beliefs were around seizures. Do people still have some, maybe not that necessarily, but do people still have those kinds of misunderstandings when it comes to seizures and epilepsy?
Yeah. So in general, a lot of our patients who have seizures and who have epilepsy, we're not exactly sure where their seizures come from or why. Some people have a genetic predisposition towards epilepsy. So somebody else in their family may have epilepsy, or they may be the first person in their family to have epilepsy associated with a genetic cause. Some people have injuries that cause epilepsy. Some people have structural abnormalities in their brains that cause seizure activity. So I think, yeah, the number one question that people ask when they come in is why? And then it brings you to the next step. Well, what kind of epilepsy do I have? And so that's where we come in and we do some studies. We find out as much as we can, and then we decide what the best avenue is to treat their epilepsy.
Okay, so there's lots of questions regarding seizures, so we'll get to them. One that came in when we were soliciting these questions was, my child has seizures. Can seizures be fatal, and can my child outgrow them?
Is that for me?
Either one, probably let me start with Dr. Santos.
Okay. Well, the first one is, could seizures be fatal? Yes. And that's the reason why having seizures is a type of neurologic emergency. If you're having recurrent seizures, you need to be on treatment. I say recurrent, but that doesn't mean you have to wait for the 10th one. We normally recommend seizure, depending on the situation, after the second seizure. But on some instances, the minute we hear the seizure, we start talking to you about medication, because yes, it could hurt you and it could be fatal. I don't know if you guys are familiar or has heard the term SUDEP, S-U-D-E-P. It's sudden death in people with epilepsy, basically. So the incidence or the chance of dying suddenly in people with epilepsy is higher than the general population. So yes. And the second question is, remind me again.
Can children outgrow seizures?
Yes. That's the nice thing about being a pediatrician. There is always this good subpopulation of kids that they do very well. So a good example in people with epilepsy, right? We always say 70% of kids with epilepsy will outgrow them. I cannot say that for adults. Okay, so yes, in certain kinds of epilepsy, if we could identify what kind of epilepsy you have, remember I said there are different kinds of seizures, different kinds of epilepsy too. The chance of you outgrowing it could be as high as 95%.
Wow.
So in general, we give the figure 70 when we're just starting the conversation, because we're still trying to figure out what kind of epilepsy you have.
So Lauren,
So,
is that
yes.
something you try to help manage for the families who come in, that when you hear a diagnosis of epilepsy, is it hard keeping parents and worried family members from going to worst case scenario right away? I mean, because that's what Dr. Santos said, that's pretty optimistic. I mean, obviously it's still affecting them in this moment, but the chances are fairly high that a child might have a situation in a case that they do have a situation that they can outgrow this one.
Yeah,
Oh, yeah.
yes. I think parents are always worried when they first come in. Number one, because seizures are scary looking. We see a lot of seizures, and we still get nervous, you know? So, but the thing to remember is that everybody's seizures are a little bit different. And so that's why we talk a lot with families about the different seizure types. And if we can control the seizures the best that we can, then we can eliminate some of those worries about, you know, is it safe for my child to go to school? Is it safe for my child to have a sleepover? Is it safe for my child to swim? Things like that. So we'll address all of those questions that parents may have.
Okay, Dr. Santos, someone asks, is medication the only treatment for seizures?
Not the only treatment. We normally start with medication, obviously, but there are so many different kinds. And I'm glad that you asked that question, because a lot of people would think that if you are taking medication and you're still having seizures, there's no more hope. And that's wrong. At the Valley, we offer everything that an epilepsy patient would need, including medication, so pharmacological, non-pharmacological medication, ketogenic diet, VNS, which is a vagal nerve stimulator. We could talk about that more specifically if a question comes up, and different types of surgical options. So remember, I said 70% will outgrow it. If we are seeing you for the first time, what we normally say is, we put you on the medication. I could control, or we could control your seizure 65% of the time. Unfortunately, in the 35% remaining, you have to play with medication. But if you failed 2 seizure medications, the likelihood of you becoming seizure-free drops significantly. And that's when we need to start talking about non-medical options, surgical options. Yeah.
And that is something that Valley Children's has really taken the initiative on leading here in the region. So many parents are so scared when you talk to them about surgical intervention. But sometimes, as you both are saying, sometimes that's the only recourse. If medication, ketogenic diet, lifestyle changes, if everything else doesn't work, that there are surgical options that have been proven to be effective, right?
Correct. Remember, go ahead, Lauren.
Yeah, so, and as we go through the surgical workup, part of my job as a nurse practitioner is really to help parents understand what that surgery may look like. So just a personal story, when I was asked to be in charge of the epilepsy case conferences and talk to parents about surgeries, I didn't actually know what the surgeries looked like. So I was concerned that maybe, we were taking the tops of children's skulls off, things like that. And so I think that's the perception that a lot of parents have. Also, in the past, with less advanced technologies, sometimes the seizure surgery outcomes weren't as good. So I like to talk to parents about what that surgery is going to look like, what the recovery time is going to be. The surgeons typically talk to the families a little bit more about the risks, but the reason that we have a whole team is that so that everybody can have their input on what they think is going to be the safest surgery for their child and what is going to be the best, most effective surgery for their child.
Dr. Santos, you were going to say something as well.
Well, I wanted to emphasize the point that when we talk to you about epilepsy surgery, we are really talking about doing the workup to see whether you're a surgical candidate. Most people are so scared that the minute we talk about epilepsy surgery, we're going to be doing surgery. No, it takes a whole lot of work.
Oh, did your automatic light kick off?
Yes, I know, right?
You need to move a little more, Dr. Santos.
No, this is not the thing. It's the automatic setup. If you're not, I guess I need to move my mouse constantly, right? Anyway,
it's fine. Yeah.
Most people think that when we talk about epilepsy surgery, we're going to do epilepsy surgery. So the minute that we sit down and explain to them, no, that's not what we're going to do. We're going to really look into the possibility whether your child is a surgical candidate. And this would mean this, and this. And then they say, okay, let's do it. Let's do it. So you also have to remember, when you pointed out that most people think of epilepsy as a curse, that's a bad think I must have done something. That's why I have epilepsy. It's interesting that a lot of people are still afraid. And so, and I think that's one barrier to um, information.
Yeah.
Why people don't get information about seizures, because they're scared that that's unique. So I usually start my conversation with parents that having epilepsy is not unique to your child. There are X number of people here in the valley with epilepsy. It's not unique to your child. And then you could see them settle down, you know, and then you explain to them the meaning of epilepsy. You see them settle down some more. And then you tell them 70% will outgrow it and 65% you could control it. You see them settle down some more. So by the end of the visit, you see their facial expression change. So we need to do a lot more. And I'm glad we're doing this as a way of informing people.
Lauren, you were, did you have something to add there too?
Yeah, so this is why Caitlin is kicking off our epilepsy support group, so parents can talk to other parents. And a lot of parents don't realize, they think that their child is the only child in their school who has epilepsy. But when they start talking to different people, they realize, oh yeah, there's actually somebody in my child's class who has epilepsy, or there's somebody who also goes to our church who has epilepsy, or you know, this person is an adult who has epilepsy, and they can speak to that person so they can say, you know, what does it feel like when you have a seizure? So they can learn a little bit more. And we're really, really excited about our support groups.
Yeah. So Lauren, for those of you who are watching us right now on Facebook, Lauren is referring to Caitlin Bernard Vincent, who is the new epilepsy program manager at Valley Children's. And so for those of you who have already been seen in our neuroscience department at Valley Children's for epilepsy, you should be getting a letter in the mail soon about how to join our programs and get on the mailing list. For those of you who have not received that letter yet and would like to learn more about joining our program, and this is not medical, this is solely for education and peer support, parent support, advocacy. Feel free to direct message us here on Facebook with your email address, and we will get you on our distribution list. There's a paint night coming up. We've got peer support groups that we're setting up. Caitlin and Lauren and Dr. Santos doing a lot of work on the back end for that. So again, for those of you watching this right now who are interested in learning more about patient and family support groups and programs, drop us in the DMs, hit us in the DMs with your email address, and we will get you that information. Okay, another question. Can I always tell if my child is having a seizure? Not all the seizures are the big ones you see on TV with, oh, put a belt in their mouth and all the crazy, you know, all the stuff you see like that. I remember, Dr. Santos, you introduced me once to one of your patients. And by the way, Soraya says hello. Soraya is watching this on Facebook right now. So she says hello to all of us. For those of you who don't know Soraya's story, let's go ahead, Rob, who's helping us on the backside here. Let's drop Soraya's story in the comments to you so you can watch that. Soraya needed surgical intervention for her seizures, and she's doing remarkably well. But I remember her mom, Dr. Santos, telling me that sometimes Soraya was having a seizure and you couldn't even tell. She would just sit there, and unless you were watching her, like her eyes would kind of shift and she'd look glazed for like a moment, and then she's back. So how can you tell? Sometimes you can't, or it might be subtle, right?
Yes. So again, going back, right? I mentioned that there are so many different kinds. If you look at seizure types in kids, slightly higher than 50%. So it's actually 52% will have partial seizures, and then the big ones, which is the generalized. It's the partial seizure that's so hard, mostly the partial seizures, that's so hard to pick up. I say mostly because absence, which is an absent seizure, or absent seizure is where the kids stare and they may just do that with their eyelids, and 10 seconds, 20 seconds later it's over. So it's so easy to miss. So yes, sometimes you can't, unfortunately. Complex partials, simple partials. I mean, I have a patient in the EMU right now. I came in after the first night And I told mom he had a seizure, and she goes, "Really?" I said, "Yeah, around 10 o'clock in the morning." And I said, "You were right there, and he was looking at you, but he didn't say anything because he was having seizure, and no one picked it up."
Okay, so
So
as a mom of two kids, that's terrifying to me to hear. Oh, well,
yes,
I
yes.
mean, so how do you know? Or is it a case where you won't even know unless the seizures do get to a point, or the child eventually does have a bigger one that is more noticeable?
Unfortunately, but I always tell parents, because what happens is they're going to be watching your kid like this, they're going to be watching them like a hawk. I mean, literally like a hawk.
Mhm.
They're going to be on top of the kids even when they are asleep. The kids going to lose their bedroom because either your bed gets moved to the parents' bedroom or you sleep with the parents.
Mhm.
And no, that's not the right thing to do. I
Yeah.
mean, yes, there are instances where you could miss seizures. We try to educate people what the seizures look like. And then when we record seizures in the video EEG area or in the EMU, we educate parents. Okay, you thought that this was a seizure, you think that was a seizure, and that was a seizure. No, actually, only one of the three that you think are seizures are actually seizures. So this is what it looks like. So we educate them. But
Okay.
yes, there's always going to be that piece where, am I going to be missing some? Yes, but I don't want you to think like that.
Yeah. No. No.
And Zara, what parents can do when they feel like their child's having a seizure or doing something abnormal, as long as the child's safe, they can get a video of what the child is doing. So typically with staring complex partial seizures, typically they'll last anywhere from 30 seconds to about a minute. And so what you want to do is call your child's name, see if you can get their attention, touch them. Sometimes parents will tickle their kids and see if they respond. A lot of times after a long episode, they'll be very tired. They may be confused. They may look around like what just happened. They may complain of headache. So a lot of our parents tell us that's a telltale sign that he had a seizure, even if you didn't, or she had a seizure, even if you didn't witness the seizure.
So sometimes it sounds like be aware that you might not spot the seizure, but you'll certainly see the after effects of it and keep track of that.
Mm-hmm.
Correct.
And then speaking of what it comes to safety measures, a question that comes up a lot to our marketing and communications team, and I'm sure into clinic for both of you, is my child is having a seizure. And my assumption is we're talking about the bigger ones. What safety measures do I need to do while my child is having that seizure? I don't know which one of you wants to take it. Open it up to both of you.
Go ahead,
Doug.
Lauren.
Okay, so like I said before, everybody's seizures are a little bit different. So some children do have big grand mal seizures. Some people have seizures with less shaking. But in many instances, in most instances, people are not aware of their surroundings. So you want to make sure that they're in someplace safe. A lot of times we'll put somebody who's seizing on the floor on their side. We want to make sure that their airway is open, that they're able to breathe. A lot of people salivate a lot when they have a seizure. So if you turn them on their side, their saliva will go to the side, not down their throats. For prolonged seizures, we do have rescue medications that you can give. And when you speak with your neurologist, they'll give you a plan for how to manage your child's seizures, what medications you'll give, what you'll do during the seizure. Timing the seizure is always important. And like I said, getting a video of the seizure, if it's safe to do so, if somebody's there to help you, you can show that to your neurologist, and that will give your neurologist a better idea of what the seizure type is.
Okay. So Dr. Santos, someone asks, if my child has seizures, when do I need to call the doctor? Do I need to call the doctor every time?
Well, before I answer that, I'm going to add something to what Lauren just said, right?
Sure.
It's not unusual for people to say, I put something in his mouth because I'm concerned that he's going to swallow his tongue. Kids don't, or anyone, you're not going to be able to swallow your tongue. It's not going to. The sound they make is part of the seizure. When the whole body is having a seizure and it's contracting, including your vocal cord, is going to be close to close, and so it's trying to push air as your chest is going to contract. That's the noise you hear, and it's usually locked or in synchrony with the movement, right? So the best thing to do is not put anything in their mouth. Don't stop the seizure. If you put your finger in their mouth, either they bite your finger or they bite whatever you put in there and catches the tongue, and you end up with more problems. So don't put anything in their mouth. That's different, obviously, when they're eating. And so Lauren made mention you turn their head to one side, so you could just swipe whatever you could see, but don't force their mouth open, because you're not going to be able to. And people say, okay, I tried to hold them down, hoping I could cut the seizure short. No, you're not going to be able to do that. So just leave them alone. So what do? You know what to do now. You put them on the ground, preferably in the middle, where they're not going to hurt themselves. There's nothing blocking their face. That if they're wearing something tight, loosen them up. Turn their head to one side, and if you're with somebody, just say, okay, can you stay with him for a minute? I'm going to call 911, right? I will tell you 97% of the time seizures last less than 4 minutes. You say 4 minutes, that sounds like a whole day.
It seems like a lifetime when you're
Right,
watching somebody
seizures.
have a seizure.
True, but if you did what Lauren just said, that's the time is like this, right? And then you call 911. By the time you come back, I'll tell you that 4 minutes is almost over. And you see if the kid's doing this, and then all of a sudden you see the jerking go like this, that's going to stop, right? So they start like this, they go like this, and then they go back like this, and then stop.
So is there ever a situation after a grand mal seizure where are there any signs? Anytime we have providers on and nurses, they always say, no one knows your child better than you. So if at a certain point after the grand mal seizure, something doesn't seem quite right, could that be the trigger maybe to give you guys a call, give their pediatrician a call?
Well, I mentioned already, right? Your child is having a seizure, you do the first aid or the precaution, you call 911, and then 911 gets there, then they get to decide your child is fine, you don't need to go to the emergency room. The last thing I want to tell parents is, after 1 year of your child having seizure, you're going to be more comfortable watching. No, it never gets easy. And one seizure could be completely different than the next. So you cannot tell a parent and say, that's okay, you stay at home. You cannot do that. I can't. I have not done that. Okay. So if it bothers you and you're concerned that the color is still not right for your child, and the jerking has stopped and he's still having difficulty breathing, by all means, call 911 or take them to the emergency room.
Okay. A question that came in, I'll give this one to you, Lauren. We are in the middle of a pandemic, and the one thing that we have seen is an increase in the fears of parents who need to take their children to the doctor for just routine checkups. And so a question that came up over and over the last week was, is it still safe for me to take my son or my daughter to clinic for an appointment?
Yeah, so the good news is that we have a lot of screening in place. So when you come into the clinic, you get your temperature taken. They ask a number of questions. And you can be confident that when you come into the office, everybody is going to be wearing a mask. Everything is going to be cleaned. All of those things that are reassuring that you may not have outside when you're going to the store or things like that. So the hospital is still a safe place to be, but if you're not comfortable coming in, we're offering telehealth visits. So if everything's fairly stable with your child and you just need to talk about medication management or just updates on how your child is doing, we're happy to help you stay at home, and in the convenience of your own home, we can do a telehealth visit.
Okay. No, that's a good reminder. I was just telling someone the other day, I had to go to Costco for my typical Costco run. I feel a million times safer walking into a Valley Children's facility where all of us have to wear masks and goggles as soon as we step out and are around other people. We all get temperature checked. We all get health screens. Our visitors all get screens. We have a lockdown visitor policy, only one parent or guardian per child. I mean, but it is a struggle. I'm sure Dr. Santos and Lauren, you've seen people who are like, I just don't want to come in, but that is the last thing they should be doing, is canceling those appointments, right?
Yeah, especially if you're noticing changes in your child, especially anything physical, having difficulty walking or weakness, or if your child just looks different to you, we do want to see you in the clinic. We want to be able, as usual, to test their strengths, to talk to them, things like that. So we can do a lot via telehealth, but if your provider requests that you come in and see them, then I hope you will.
It's a lot safer than walking into a grocery store, I'll tell you that much. Here's something that came in, Dr. Santos from Facebook. My son has the SCN2A gene. Will he always need medication?
So when we started talking about genetic testing for a number of diseases, and that genetic testing has gone to the epilepsy realm, we've been identifying people with gene defect that predisposes you to epilepsy. The best information that we get when we do that, and when we get the information, is it tells us what medications to use and what medications to avoid, right? Which medication is more likely to work and which medication may make it worse or work. So it's a little long answer to your questions, but once you have a genetic defect, it makes it less likely for you to be on the 65% that will respond or outgrow it. Now, you may respond and be seizure free, but likely not on the 70% that will outgrow it, unfortunately.
Okay. Here's another question related to something you were talking about, Lauren, about videoing your child, if you can safely do so while your child's having a seizure. So someone asks, what about if my nonverbal child is spitting or lip pursing? If I call his name and he responds, does that mean he's not having a seizure?
More than likely. So some people are able to speak while they're having a seizure, but typically it won't be anything that makes sense. A lot of children do self-soothing kinds of things. We all have our own little habits. And so just to notice if that's something that your child seems to do when they're bored, when they're not engaged doing something, or when they're nervous or anxious. So we really look at patterns of behavior as well. But so if he's responding to you, you don't notice any change in his affect, then most likely not a seizure. I will say this, we have had parents say, I think my child's having seizures. And we say, that doesn't sound like a seizure. And then we get them on EEG, and what do you know? It's a seizure. Other times, parents don't think their kids are having seizures, and they are. So, sometimes it just takes a little bit more investigation, but we're always happy to see those videos and to help you guys out. And actually with Epic now, we have the ability to upload pictures or videos if you need to.
Oh, we lost Lauren. Uh-oh.
Same thing.
Oh no. All right. Okay. So we'll get Lauren back on in a minute. Okay, Dr.
Hold on.
Santos.
Can I add something to what you asked me about the genetic defect? I don't want people to think that each one with an identifiable epilepsy gene defect will have seizures forever. Remember I said there are epilepsy syndromes.
Mm-hmm.
And then when you're thinking, okay, this sounds like an epilepsy syndrome, let me verify it with the gene test, and you find that it's true. There are epilepsy gene defects that are good. You give them the appropriate diagnosis, and you tell them your child is going to outgrow this 100% of the time, or 95% of the time. So not all gene defect means what I just said earlier.
I mean, it's very hard to make blanket diagnoses.
No, you can't. But I don't want them to take home that. Okay.
No, that's a good reminder. Okay, here's another one that came in through Facebook. Does my child's seizure or epilepsy diagnosis mean that other people, hi, Lauren. The way we do things now, it's like, it doesn't even phase, like when kids run through shots, you hear the dog barking, doorbells ringing, we lose connectivity. It's like, whatever. Welcome back. So Dr. Santos, does my child's seizure or epilepsy diagnosis mean other people in my family might get seizures too?
Yes, depending on the seizure type. There are, I'm going back to the term epilepsy syndrome. Epilepsy syndrome is a constellation of things that put them in a square or a peg. Right, so we know that the type of seizures they're going to have, the medication that's more likely to work, and so on and so forth. There are genetic epilepsies that are autosomal dominant, meaning you only need one copy of the gene defect to have the disease. A good example is what we call nocturnal frontal lobe epilepsy. Okay, nocturnal meaning it happens at night, frontal lobe because the seizures are coming from the front. Those are autosomal dominant. Benign infantile epilepsy of childhood or fifth-day seizures. You know, each baby born to that family has a seizure on the 5th day of life. And then you get a history and say, oh yeah, my dad was like that. And you say, okay, I think I know what you. So yes, there are epilepsy syndromes that are genetically linked.
Okay. Okay. So that could be the case, then it sounds like in some instances.
In some instances. Yeah, that's why we do the genetic testing.
Okay. So Lauren, speaking of technical difficulties, many kids since March have been attending school like this. But many schools are starting to open up again. So we've received lots of questions from families who are saying, is it okay for my child with epilepsy to go back to school when schools are safely reopening? And also, what should I tell my child's teachers and school nurses about my child? And I'm going to turn off my camera just for a second because I have to plug in. See, I have to plug in my laptop real quick because it's losing power. So why don't you answer the questions about preparing your kids to return to school, please?
Yeah, so I do want to tell you, your kids' teachers and the school nurses are so excited for the kids to come back. They've sent us all the seizure management plans, and we've been working diligently to get those back to them in preparation for school starting. So it really depends, again, on your child, how complex their medical needs are. A lot of the smaller classrooms, the special education classrooms, are opening up again because they have less students. And then other schools have different measures in place. So as long as you're comfortable with the measures that your child's school has in place, absolutely, go ahead and let your kids go back to school knowing that the teachers and the nurses are ready. They'll be watching. They can always call us if they have questions. You can always call us if you have specific questions. We're happy to work through those with you, just to make sure that you feel as comfortable as you can when it comes time.
There we go. So I plugged in my laptop, so we're good. Dr. Santos, that's a question we get a lot, where we get families saying, well, what do the doctors say? Is it okay to send my child back to school? And we've had our own infectious disease experts come on and say, that's a very personal decision. Depending on the family, there's no shame in keeping your kids at home. There's no shame if you choose to send them back. And so for this particular patient population, Dr. Santos, any concerns about kids with epilepsy returning to the classroom? Or as Lauren said, it's like, well, if schools are doing what they can, so if you're okay with it, go for it.
Yeah. The way I answered that is, and the the infectious disease people are correct. It's a person. It becomes a personal decision, and we get a lot of those questions that the parents should be able to answer. However, I always tell the parents, okay, I just told you your son has epilepsy, right? And then the worst thing I could tell you is to limit that child's activity and treat him as an epileptic and basically put him in a bubble.
Mhm.
I mean, it's hard enough to say, okay, you have epilepsy, and then you tell them because you have epilepsy, you cannot ride your scooter, you cannot ride your and you cannot. No, there are things that we tell people you cannot do or you try not to do. You don't swim alone, you don't take a bath. Because I said, well, can you imagine if he has a seizure while swimming,
Mhm.
has a seizure while taking a bath, and no one's there? Other than that, we try to treat them like regular kids
Mhm.
because there is a stigma already. You
Yeah.
know, I have epilepsy, and to add something to that, it just makes it so hard. No.
Mhm. Lauren, we were talking earlier about how scary this diagnosis can be. When you couple new diagnoses with the increase in behavioral health issues and concerns nationwide, especially among kids, how do you help families adjust socially and emotionally to a new epilepsy diagnosis?
Yeah, so it's really important that we put ourselves in the kids' shoes, especially teenagers. They're very worried about whether they're going to be able to drive, whether they're going to be able to work, things like that. And, you know, even for smaller children, when they're wondering, am I going to have a seizure at school? Who's going to be there? Who's going to take care of me? What is it going to look like? Is it going to be embarrassing? Things like that. So a lot of times we'll refer to counseling. We have really awesome psychologists here who see a lot of our mutual patients. They're wonderful. And then again, epilepsy support groups. So to go and talk to other families who know what you're going through, have ideas. You know, we have a lot of medical training, but we also get a lot of our information from parents. This is what we do, you know, this is how we plan our outings, things like that. And then to come back and share that information with us so we can say, you know, yes, this applies to your child or may not apply to your child. So just all around support. A lot of schools have wonderful counselors too who are willing to talk to children. So anyone that your child connects well with, we like to foster those relationships and keep the communication open.
Great, thank you. This message just came into Facebook, Dr. Santos. This person says, I've read several studies regarding CBD as an effective treatment for epilepsy, particularly when the patient did not respond to other meds. And there goes Lauren again. Where do you, oh, there she is. Hi. Where do you both stand on the issue of CBD as a treatment for epilepsy?
Well, we actually used CBD before it came to market as as a part of the pharmacologic management, right? Because you're right. I mean, if you are up against the wall and medications have failed, I'll put you on CBD. But that's how it should go. I should try you on where we have more data and information and long-term data before I put you on CBD. I mean, we have had parents who would say, I don't want that medicine, I just want to go to CBD. No. So there is FDA approved CBD, which is called Epidiolex. We use it a lot. Do we get good response? Yes. I mean, we have had parents and patients, I'm sorry, that are seizure free with the addition of CBD. So yeah, it's always an option. That's something we discuss with you either while we're trying to introduce the likelihood of, excuse me, of epilepsy surgery. They say, okay, I think we need to think about epilepsy, but before we get there, maybe I'll start you on CBD.
Okay.
Yeah,
Lauren.
you need to remember that it's another compound. It's like another medication. Your body processes it like a medication. It's processed through your liver. So if you are going to try CBD, we like to talk to families about it, the potential interactions that it has with the medications, what our expectations are for the success with CBD, and absolutely what the source is. So never be afraid to talk to us about any kinds of treatments that you've heard about and that you're interested in trying.
Yeah, but don't go online and buy something from a dispensary that's without talking to your doctor, is what you're saying.
I was just going to say that because Lauren
Yep.
pointed out something. And the reason being, one, she mentioned already the drug-drug interaction.
Mhm.
It could elevate some of your drug level, it could drop down some of your drug levels, and you do not know what you're doing. Number two, what you think could be CBD is not actually CBD. Okay, and therefore you're going to say, okay, but it's really not working. You keep bumping up the dose, and you can end up with more problems. The good thing about the Epidiolex is for the first time we know exactly what you're getting.
Okay. Yeah. So don't just
So
go on the internet,
be
buy
very
it. Talk to
careful.
your
We know
doctor.
you're well intentioned when you do that, but be
Yes.
very careful.
Yeah. Okay. Lauren, and Dr. Santos said earlier, for children with epilepsy, they should not swim alone, take baths alone in case something happens. We obviously that would pose very grave danger. Parents want to know, are there any other sporting activities or any activities in general that children with epilepsy should not be doing, or maybe take a little more caution doing?
Right. Yeah. And I always tell parents too, nobody should swim alone. So
Right. Exactly.
we always we always caution people about letting their children climb on big structures. So if they were to have a seizure while they were climbing and fall, that would be concerning. And in general, across the board in neurology, we tend to avoid contact sports, football, hockey, rugby, but we always tell schools if the children want to play basketball, if their seizures are fairly well controlled and they want to play soccer, volleyball, baseball, anything like that. So if your child is having a lot of seizures, we want to do what we can to keep them safe. And it may not be a good season for sports, but ultimately our goal is good enough seizure control so that they can do everything that they want to do.
Okay. Dr. Santos, anything to add for that?
No, I think that's pretty good statement right there. We really try to get them to a normal schedule as much as we can.
Okay. And speaking of activities, one parent asks, does my child need to wear a helmet for any type of activities? Obviously, bike, scooter, skateboard,
Right.
every kid should be wearing a helmet. But is there anything else that children need to wear helmets for?
Well, obviously, right? We don't even need to talk about riding bicycle and wearing helmet.
Wheeled
Right?
modes of
That's
transportation, wear a helmet.
all
Yes.
understood.
Yes.
There are subpopulation of patients where we actually prescribe helmets and
Okay.
different kinds, either soft shell, hard shell with a face bar, because there are patients with what we call drop seizures or atonic seizures where you'll be eating and then they just, that's what you hear. It's the noise, right? So they fall face first. So they come to the clinic with a line on the top of their nose because they broke their nose. They have black eyes. They have broken front teeth, and so on and so forth. Those we would even talk to you about using helmets. So we have special places where we send you, and we say, okay, I want a face bar or something that protects your face.
But that's customized to the child based on their type of seizures they suffer.
Correct.
Okay.
So outside of what's required for you to do on a routine activity, wearing helmet during a bike, if you want to play football, which we don't like, even in practice, even I don't care if it's a touch football, you need to wear protected headgear.
Okay. Okay, good to know. I think we actually got through all the questions. So
Really?
Is there anything else you wanted to add, Lauren or Dr. Santos, that we might not have covered? Oh, here's one. We get this anytime we have an issue. Dr. Santos, does having epilepsy make my child more susceptible to contracting COVID-19?
Epilepsy is just like any other chronic disease. Asthma, right? Diabetes. It makes you prone to the common illnesses, and that's true for kids with epilepsy. Not for all of them, it's more common in people with other medical problems. For example, you have cerebral palsy, in addition, you have seizures, and it just makes it more likely to happen. Okay, but your run-of-the-mill epilepsy kid with who are healthy otherwise, I don't think so.
Okay. Okay. Thank you. Thank you again. And also there were people asking, we do have a special unit in Valley Children's Hospital called the Epilepsy Monitoring Unit, which is where this fine team monitors children for seizures, and everything's recorded 24/7. Parents are asking, with all the lockdown restrictions, does my child, if my child has to go to the EMU for 2 days, 3 days, whatever, does my child have to be alone that entire time?
No, no. We actually don't admit people if a parent cannot come.
Okay.
There's always one.
Yeah.
And we have made exceptions, obviously, where both parents need to be there for whatever reason. But you have to have one parent. Why? Because we would like for you to tell us, this is the type of seizure I'm seeing at home.
Mhm.
Okay. Because you are an active participant when your child is getting monitored or having pre-surgical evaluation. So a parent needs to be there. And so, yes, the EMU is open. We were closed for maybe what, 3 weeks at the most?
Yeah, not very
Probably,
long.
right? So I guess people are wondering, okay, you guys have been talking about epilepsy surgery. What's the kind of outcome? If you look in the literature, what you're going to see is 66% of people will be seizure-free on the most common surgical treatment, right? There are several different treatments depending on the type of seizure. We have operated on a number of kids already, and I am happy to share with you guys that our seizure freedom is 79%.
Wow, that's incredible.
That's incredible. Can you imagine if I make Soraya an example?
Yeah.
Okay, so Soraya,
One of our patients we've
one of the
profiled.
patients,
We'll be sharing
okay,
her video.
she's 13 or was 13 at the time. She has had seizures that are medically refractory or difficult to control since age 5 months. So the parents were resigned on the fact that she's going to have seizures forever.
Mm-hmm.
Okay, they have never traveled outside of the home without having a seizure. So it's either on the way out or on the way home. And so they try to avoid trips. Long story short, we did the pre-surgical workup. We were able to find that the seizure is coming from one side of the brain. We did the surgery on November 2nd, 2017.
Yep.
2017, 2018,
Was it 17?
2017.
You and I were both in the operating
She
room for
was,
that one.
she
I
was,
can't remember.
she was one of the first ones, right?
Yeah. Yeah.
She walked out of the hospital on November 7th.
Yeah.
The day we admitted her, the morning of the admission, November 2nd, she told her mom, "Mom, this is the day." And her mom said, "What do you mean?" "This is the last day I am going to have seizure." So to this day, Soraya is seizure free. So most people think of epilepsy as having seizures, right? And I always say this. Epilepsy is not just about seizures. It's about the effect on your family.
Mm-hmm.
It's about the effect on your psyche. Your stress level is high. You get so frustrated. You're taking medications every day. You cannot do this. You cannot do that. There are so many things. And consider an adolescent who's newly diagnosed with epilepsy. Can you imagine what that means if I tell you you cannot drive? That's a big thing. Anyway, so for
You're making
Sarah,
us cry and get all emotional now talking
well,
about Soraya.
I
Look,
get
you made
emotional.
your nurse practitioner cry.
When we talk about pre-surgical workup, we do neuropsychological testing before and after, right?
Mhm.
Soraya was functioning between ages 4 and 5 before surgery.
And at the time she was what, 11 or 12 when you did
13.
surgery? 13, that's right.
6 months later, we retested her and her age equivalent performance doubled to 8 and 10.
Yeah.
Okay. So that's the thing. It prevents your brain to develop or function properly.
Yeah.
So it's really important that you come to a place where you say, okay, my child has failed medications, and I think, I want to pursue that possibility whether he or she is a surgical candidate. And the sooner, the better. The sooner, the better. I cannot emphasize that anymore.
No, thank you for sharing that. I will never forget meeting Soraya and her family. And I remember Barbie, her mom, texting me not long after surgery. They went to San Francisco for a weekend trip. And it was
Disneyland.
was it Disneyland or San Francisco?
Yeah.
Okay. And it was the first time that they were able to travel without having to worry where the closest hospital was, where the closest urgent care or emergency department was. And they enjoyed an entire weekend without that worry. And to your point, epilepsy isn't just a medical condition. It affects
Everyone.
everything. And so I've had friends who've asked me about the neuroscience team, and I tell them, I said, not only do I trust them to go into my brain, but more importantly, I trust them with my kids' heads. So I mean, it's just, so thank you, Lauren and Dr. Santos, for everything you do for Valley families. I do want to share one note that came in through Facebook. Her name is Kia. I'm a child with epilepsy. I've been at Valley Children's for 13 years. Doctors Santos and David know what they're doing. So parents, let them guide you on what is best for your child. I'm telling you, as a child who has gone through this, sometimes your child's not going to be happy, not easy to accept this news, but please listen to the doctors. They know what they're doing. Thanks, Kia, for that message.
Yeah.
And now that my gardener's here, I think this is a good chance to wrap this up. So Dr. Santos, Lauren, thank you again. We do have so much information on our website. We're going to put it up right now. As we mentioned earlier, Caitlin is our new epilepsy program manager. And so please, please, please send us a direct message with your email to get on her mailing list. We've got a website with so many resources for families. Really easy to find, valleychildrens.org/epilepsy awareness. We always get lots of questions about appointments in the time of COVID. So we can also answer all your COVID questions. The website is there. And we also have a hotline that is staffed by nurses from Valley Children's to answer any and all of your COVID questions. Toll-free number is 888-286-9336. The local number, if you're in the 559, is 353-3333. And we encourage you, as always, if you ever have a question, folks like Dr. Santos and Lauren are there to answer them. And if you have COVID questions, call our hotline. Wear your mask, social distance, wash your hands. We'll see you here next time. Have a good afternoon.
Can I ask a question before you close?
Yeah.
Epilepsy awareness, is this limited to kids?
No. What do you mean?
No,
our
no.
program. No.
I'm an adult. I have an epilepsy question. I'm an adult. I have epilepsy. Can I come to your thingy?
Absolutely. This is for all families in the Valley who are dealing with and living with epilepsy. Plus, it's, a lot of the times, especially like in programs like cancer survivorship, it's the adults who are helping either the parents of newly diagnosed cancer patients or the cancer patients themselves. And so yes, thank you. That's a good reminder. Epilepsy affects, it's not like, oh, you're 19 years old with epilepsy. No, we don't have resources for you. No, this is for everybody. So thank you for that reminder. Caitlin would love your information. So send us your emails. Yeah, the gardener's getting louder. So I'm going to go. Take care, everybody. Thank you again.
Thank you very much.
you. Bye, Kia.